Hello everyone. Welcome to the channel. This video is specifically made for RSO exam aspirants. We will be sharing few questions and numericals from previous year exam that were little tricky to solve. This video is compiled by Ajay and Gurkirat using inputs from previous year pass-out students. We also thank them for their inputs. Do like, share and subscribe the channel. Let's start the video.
So it is a numerical where activity of technetium is given and activity of iodine 123 is given. Respectively, half-lives are also given for both, and we need to find that after how much time, after how many hours will both the isotope will show the same activity. So what we need to do, we know the formula for activity and decay of the activity. So we need to apply the formula for both technetium and iodine 123 as well, and we need to equate them in such a way. So here you can see the solution of the question is we have equated the activities of 99 technetium as well as of iodine 123, and we are finding the time after which the activity will get same for both of them. So the answer will be 28.4 hours. Frequently asked RSO question, the critical organ for tritium 1H3 is whole body water. So what are the 4 R's of radiobiology? It is B, repair, reoxygenation, redistribution and repopulation. And 5th R of radiobiology is radiosensitivity, which refers to the inherent sensitivity of different cell type to radiation. Another numerical where we need to find the attenuated photons after this particular thickness. We have given with mass attenuation coefficient of 1.8 gram per cubic centimeter. Density is 0.2 centimeter square per gram for 80 MeV gamma rays. And what is the percentage of photons that will get attenuated by 4 centimeter thick slab of bone? So this is the solution for this question. So we need to apply the I equals to I naught e to the power minus mu x formula, where mu we note that it is a linear attenuation coefficient. Since we can calculate linear attenuation coefficient by multiplying mass attenuation coefficient and density of the material, so we'll get the linear attenuation coefficient. By using this, we can get the fraction of transmitted photons. This formula is being used to calculate the fraction of transmitted photons or transmitted intensity. So by using that, if we subtract it from 1, we can get the fraction of attenuated photons here, which will come out to be 76.4%. So the basic reason behind performing QC and QA of imaging or non-imaging medical equipment. Here in this question we are saying all options are relevant, but with respect to different priorities. If only one option must be chosen, so we will choose to reduce dose to patient. That is our primary objective. You all know that filter back projection is being used, is commonly being used for image reconstruction in PET imaging. Here PET is not detecting positrons directly. there is a process of annihilation of photons. So annihilated photons are being detected by PET detectors. So filter back projection is a technique of reconstruction of the signals into images. For this question, you can refer to AERB safety code issued by AERB for related to transport of radioactive material. So where this iodine 131 has a A2 limit of 0.7 terabecquerels, which is in curie 18.9 curies. Since we want to transport 1000 millicuries of iodine 131, so which will exactly fall in this limit. So the package selection will be type A package. When it comes to scintillation detector, we have to use such a isotope which is non-radioactive in nature, that is a stable isotope. So among all given options of isotopes of iodine, iodine 127 is the stable isotope which we typically use in a sodium iodide scintillation detector. Another important question which can be asked in a RSO written examination, which is atomic number of iodine, which is 53. This you need to by heart, that atomic number of lead is 82 and its density is 11.3 gram per cubic centimeters. And for tungsten, the atomic number is 74 and density is 19.3 gram per cubic centimeters. So in this question we have given with the decay constant, that is 1% per hour lambda. So and we need to calculate the half-life of the radionuclide. We very well know that what is the relationship between lambda and half-life is this: half-life is equals to 0.693 divided by lambda. So by using this formula you can easily calculate what is the half-life of the radionuclide. For this question it will come out to be 69.3 hours. So you all use sodium thiosulfate to reduce the volatility and volatile nature of iodine 131 and for decontamination purpose. And we have the chemical formula of sodium thiosulfate as Na2S2O3. You all know that what is the Moly 99 allowed limit in technetium eluate. It is 0.15 microcuries of Moly 99 present in 1 millicurie of 99 mm technetium eluate. In percentage it is 0.015%. So in percentage also it can be asked in examination. So you know that in tissue weighting factors are changed, either increased or decreased from ICRP 60 to ICRP 103 publication. For gonads it is reduced from 0.20 to 0.08. So the percent variation in this is 60%. So for breast, the tissue weighting factor is increased from 0.05 to 0.12, which is roughly 60% increase. So in this question we have given with FWHM of a collimator from the head is 8 mm and from the detector it is 2 mm. So if we want to calculate the total FWHM of the system, so we will square it, add it and take a square root of it. So we'll get the total FWHM of the collimator that will come out to be for this question is 8.2 millimeters. Thank you everyone, and I wish all the best to all RSO aspirants who are appearing for this year, and all the best.